Thank you. Good afternoon, everyone. Welcome to the 3rd of May committee meeting of the Children Education and Communities Policy and Scrutiny Committee. My name is Simon Daubney. I'm chairing the meeting today. Can I ask, first of all, from members around the table, do we have any declarations of interest? Councillor Fenton.
Thank you, Chair. Just in light of the agenda item on community hubs, just say I'm a trustee at Folkswood Community Centre, which currently hosts a community hub.
Thank you very much. Anyone else? Councillor Webb.
The same vein, I am also a trustee at Tanghall Community Centre.
Thank you very much. Is that it? Thank you. Right. Item 2 on the agenda is the minutes, which I understand are not quite ready, so they'll come to us at the next committee meeting. We have no public participation today, I understand, which leads us on to the apologies from Councillor Barker, Councillor Baker and Councillor Fitzpatrick. All send their apologies today. And Councillor Wardby is substituting for Councillor Barker. Right. Okay, that leads us to item 4 on the agenda, the Children's Mental Health Review of the Referral System. Would somebody like to begin introducing the support? Councillor Webb.
Thank you, Chair. I have been involved in this scrutiny topic of children's mental health and the review since its inception, which was actually pre-pandemic back in late 2019, early 2020. The original scope of the review was to look at reasons around a seeming spike in self-harm referrals through hospitals of young people. We were at the scoping stage, and then there was a pandemic, and everything came to a grinding halt, as we know. And then when this scrutiny topic was resurrected, it was obvious that it was actually quite hard to find the data around reasons for self-harm and reasons and figures of referrals around self-harm, specifically to York, and also clarification about how children and young people access services and how data is kept on those children and how they are moved through services. And actually, due to the pandemic, it was thought that it was appropriate to widen the scope slightly of this review to look at exactly that, the referral process involved and the wider concerns around children's mental health. And the report, as you can see, does have the background to the topic. The background to the review, which you've just outlined there, is in a bit more detail at paragraph 6, and on through that. We've worked jointly with the Health and Adult Social Care Policy and Scrutiny Committee as well, just to do a little bit more work with our health partners to discuss and identify their concerns, their issues and possible solutions. And then there are a series of recommendations which are outlined at paragraph 18. And the plan is to take this forwards to the Executive Committee to look at what can be done and look at what things our group found and what we can recommend as improvements and suggestions on how executive members can engage with this and hopefully push the agenda forward slightly in order to improve access and the path of children and young people through mental health services in York. And I think it's right for me to sort of record my thanks to Councillor Baker, who was heavily involved in this when she was chair of this committee. To Councillor Heaton and Councillor Vassy, who came on board when we were doing the health and adult social care stuff. To yourself, Chair, who was involved right at the start and has come backwards and forwards on it. And also to officers who've helped. And finally, if the report is not up to scratch, that's because I wrote it, not officers. And I hold my hands up and apologise for that. And it's here for any questions or comments, folks. That'll do me. Thanks.
Thank you, Councillor Webb. I think probably in terms of questions, the officer who would have responded is not here today, which would have been Jamila, who sent her apologies. Any questions, I think? Stephen?
Apologies in advance if it's not something that you're an expert on, but in terms of what you identified in terms of the bottleneck that can lead to young people not having to wait long periods for support, either sort of low level or potentially high level support. To what extent was that a combination of a lack of coordination? Because some of the recommendations sort of point to sort of better partnership working and joining up services and sharing information. Or to what extent was it a case of the services weren't funded to the extent that they could offer that the volume of services that would be needed when someone sort of presents or is identified as potentially being in need of support?
Yeah, Councillor Fenton, you're correct. I'm not an expert on this. And what I would say is actually Jamila Hussain, who's Director of Commissioning, I think that's her title, people are nodding, helped with the writing of the recommendation. So she did support on this as well. In terms of the bottleneck, I think it's a bit of both. I think there is a lack of coordination, and this was what sort of children and young people were saying, was they self-diagnose or are referred, and then there's an entry onto the system where there's an initial sort of diagnosis and there's a process of, we think this would be the service that would be most appropriate for you. Problem is that service has then got a waiting list that's quite long. And a number and there's essentially a greater number of people going on to that waiting list than coming off at the other end. And part of it could be because there isn't joined up services, there isn't alternatives. I think it could possibly be because there isn't the funding in those sort of very low level service support as well that could be going on during that waiting period. So I think it's a combination of the two, really. I mean, it'd be obvious to say that there is definitely not enough funding in the system. But I do think that the fact that, for example, there doesn't seem to be a child doesn't, and we shouldn't reduce children to numbers, but if there was a unique sort of reference number for a child that was followed through the system, I think that would be something that would be quite helpful. And there doesn't appear to, there isn't that at the moment. So a child could go in on one service, but then not necessarily be known about another. And it might sort of support that coordination.
Thank you. Any other questions? No. Should we go on to, sorry, Councillor Easton.
Yeah, no, just to follow up on that as well. I've probably said it before here. One of the things that I do is work with NHS trusts and organisations around the country. That there is a national issue regarding funding, and one of the big things is the complexity of cases that's particularly built up over the last few years, particularly around the pandemic. There's a shortage of staff as well, which has been a big problem. You see that cropping up. One of the big potential things we have here around the ICB and the ICP coming in is the idea that you can get more joined up working. One of the things that I've asked Jamila about previously on health scrutiny is the fact that with TTES Weir Valley working across 2 ICSs, where that puts us, because they're obviously situated northeast, North Cumbria and here. And we'll have to wait and see how that plays out in terms of how that's going to impact funding and the direction we get from there.
Thank you. Councillor Warby.
What could realistically be done to bring existing services together?
That's the big question. I think with the formation of this new integrated care board, this is, if we're going to do it anytime, this is an opportunity to sort of say, look, we're setting something up. There needs to be a clear pathway for children to access the service and move through, and there needs to almost be one oversight of all those different services. And that, I think, is part of the issue, that the NHS and the ICB and any other 3-letter acronym we can find, there's so many different bits and pieces that are all doing different parts of looking after children's mental health. And one of the key things is about getting them to talk to each other. You know, I'm not trying to, and I think it's really important that no one is trying to have a go at any of the services that are being provided or the people who are providing those services. Quite frankly, they're understaffed, as Councillor Heaton's just said. They're underfunded. They're chasing their own tails a lot of the time, I imagine, and don't have time to then go out and talk to each other and work out probably the best way forward. I'm no expert on this, but I do think that having sort of someone or somebody that oversees the whole process for York as would be a really important step forward. I don't think this paper sort of solves the problems, but it certainly allows our executive to just push forward and ask the questions and really be champions for children's mental health.
Thank you. I think the comment I would make at the end of that is that the pandemic has been a massive disruption to young people's lives, and that has produced anxieties which we have all shared, but we as adults find it very much easier to cope with than if you're 14 or 13 or even younger, because none of us in our lives have ever encountered such a thing before. And if you are still in your formative years, that's going to be a very difficult thing to cope with, and that introduces all sorts of stresses and strains into people's thinking. Can we therefore go through the recommendations one by one and see if we want to send them to executive as they are, or whether you want to make any alterations to the wording? Now, Councillor Webber's pointed out prior to the report that sometimes the need to include long job titles and so on makes it bulks out the recommendations somewhat, but if you can work your way around those long job titles and so forth and the various acronyms, it becomes a lot easier to follow. They are in fact to the point, I think. The first one is about the data set from which you can extract performance indicators and key risks on children's mental health in the York area. And that data set should then be reported to executive members, of course, but also to this committee on a quarterly basis. Okay, thank you. Any other nods? Yes, thank you, David. I assume you're happy with the council. Yeah. Right, so number one, we're happy with. Number two, the executive members identified above work with the newly formed ICB and ICS, TUV, CAMS and council officers in public health as well as any other relevant bodies to implement a common child reference number system across all services in York. This is something Councillor Webb has just explained to us, the usefulness of it. Any thoughts on that around the table? Councillor Fenton.
I'm not a data expert. Obviously, so you have an NHS number. Obviously, that doesn't translate into non-NHS services. But it certainly, I'd like to think it was doable, and that if it was completely beyond the realms, officers might have picked that up. But I think with all of the usual safeguards around anonymisation and pseudonymisation and all the rest of it, it makes sense.
That's all.
Yeah, just on that second one with the common reference number, that is actually one where officers accepted that it has worked in other places, but were concerned about trying to implement something like that in York. But I think, as I said earlier, I think while they're setting up these new bodies, it does seem like something that would be worth exploring. So I left it in there, but yeah, it's fair to say officers thought that one might be tricky, which seems strange to me because, you know, children, everyone has a unique NHS number. Every child has a unique candidate number, for example, as they're in education. So there is a number that exists, but it's just how it all links together. And you're right, it might be to do with anonymisation. It might be just literally the time thing, but that's worth pointing out.
Presumably, it would be helpful to one body to know that that particular child had been somewhere else and had a certain discussion with another professional. Yeah,
I think the key thing is it links quite well to point one, which is that there's clear data on, you know, we're in a situation now where you could end up double counting a child if they're accessing two services. Or if we only count one set of numbers, we might miss a whole bunch out. So that's the problem. But if you link those two together, I think that's quite valuable.
I'll just make one point that before the reports will go to executive, a cover report will be prepared by officers, which will include their comments in relation to the recommendations. So they could make any points they want to at that point. Right, thank you. Number 2 is agreed. Number 3, the executive member for children and young people in education looks to invest in early help, prevention services and peer support interventions as recommended by participants of the Joint Scrutiny Review, such as York Mind Project to develop a website for good self-help. What do we think about that? Councillor Fenton.
I think in terms of, I think one of the issues I struggle to understand in the mental health realm is where our responsibilities end and the NHS's begin. I mean, obviously it's from the child's perspective, it shouldn't matter who's providing the service as long as it's available. And I agree that in terms of early help and prevention, that A is necessary and B potentially cost saving in the longer term if support is provided at an early stage to hopefully sort of prevent. Sorry about that. So I would agree with this being a priority in terms of early investment in early help and early intervention. And in the financial implication section of paragraph 16, I'm guessing some of those bullets, which I'm guessing officers have provided, some of those will relate to, will kind of be aligned with what the recommendation is. So is it a case you're looking at sort of further, you know, if there is an alignment between those bullets in paragraph 16 and recommendation 3, we're looking sort of invest further in early help, if I've understood what that is potentially saying.
My thought on that was that for those young people who have low-level concerns about their mental health, anxieties and so on, it might be exam nerves, it might be some of the nature, might find a website very helpful to provide some support and reassurance at that stage. And that might mean they aren't waiting for long periods of time to see a professional. But it's all a question of how well that website is designed to make sure that the filtering, as it were, of need goes on in an appropriate way. Right, number 4.
Could I just say on number
Sorry.
3, that this particular bullet point, you're right, Councillor Spencer, it does link to the financial implications. The most difficult part of this was actually getting some numbers out of officers, but you know, with 3, that actually came from an online meeting that we had with the group, the Scrutiny Committee, and York Mine and Young People, who'd started this process of developing this website basically by young people for young people. But the ongoing costs to just maintain it, check it, that sort of stuff hadn't been factored in. So that was something that there and then we could say was a tangible benefit. So yeah, I'm quite hopeful about that one, really.
Okay, thank you. Number 4, that the executive member for Children, Young People Education works with the commissioners to support enhancing and redesigning pathways. To invest in opportunities to commission services will reduce the bottleneck when children report mental health and have to wait for long periods without support before it is made available to them. This could be done by providing financial support to CAMS, the School Wellbeing Service, and York Mind Counselling Services. Right, who wants to comment on that? Any thoughts, Councillor Webb?
If it's all right, Chair, I'll just nip through the last few, because I think that number 4 is just sort of investment in general at those low-level services that then do actually go a little bit higher when you talk about CAMS, so that's Children and Adolescent Mental Health Services, but the School Wellbeing Service, York Mind Counselling Services, these are things that would be able to be in place alongside whilst you might be waiting on that waiting list. And actually it might mean that you receive what you need and don't need to carry on for further, more in-depth support later on. So that's a sort of a general plea for investment, and it is just to really ask the executive to put this forward as the front and central point. Number 5 is to ask the executive to essentially take up the opportunity that they have with the new formation of an ICB and, you know, champion young people's mental health. So that one is just to go out and talk to people kind of request. And then number 6 is sort of following on from what Councillor Warby was saying earlier on about how do we help get people to talk to each other. That piece of work would hopefully join everything together. So they're the last 3. I think it was probably just easier to, if that's okay.
Your thoughts on those recommendations then, committee? Are we happy to accept them in that case? Right, thank you all very much. So in that case, that can then proceed as expected to executive on the 20th of May, I think. No? Oh, right, so this, okay, this goes in the future, right? Okay,
yes,
we don't have a date yet.
Chair, on that one, I think this committee is so impressive that we're putting so many different recommendations through that it was thought that this one, because of the complexity of the covering report someone's got to write, it was thought best to hold this one back a little bit, because yeah, it's not going to make too much difference if we do it right now or in a month's time or something like that.
Yeah, the important thing is that it gets
What-
the right support.
What I would like to just say before we move on is that if this committee is happy, could we have a deadline of, say, September or something like that?
That sounds reasonable.
Yep, happy with that. Okay, thank you all very much. The next review group was into community hubs. Who would like to talk to this one first of all?
I'll start us off, shall I?
I'm sure you can share it.
Yeah, so this community hubs is a little bit younger than the children's mental health one. And it is linked to the executive's strategy around community hubs. Again, there was talk of doing this prior to the pandemic. And then I think community hubs really came into their own during the pandemic and helped an awful lot of people, whether that was through food distribution or other elements. And I'm sure that Charlie here could talk plenty about the joys of community hubs and what they've offered. The purpose of this report was looking into what they can offer, what they struggle to offer potentially, and actually the key thing really is how do you make a community hub sustainable? What were the key ingredients, the active ingredients that make a difference to whether a community hub would survive on its own 2 feet or not? And we worked quite well. I think we interviewed quite a number of different community hub providers from around the country and looked at what is on offer in different places around the country and what the active ingredients were that really did make a difference. You can see that there is an annex to the report that's the local development strategy. This was done possibly before 2019 election, around about, I think that's before then. And that's where the initial idea of community hubs started to blossom. And then, as well as that, you also had another appendix on page 71 that looks at the project plan for local area-based financial inclusion and how that links in. And then on page 79, you have a document that was put together about what a community hub is. And then through those different points, you really do sort of start to pick out, there was a few key things that community hubs need to have. Staff was often something that people commented on as being really useful, a paid member of staff. And as you can see from paragraph 7, there was 3 recommendations, 3 points. One, that the executive take note of the report when setting policy and strategy. 2, to essentially edit and add things that they saw fit. Well, that's what we're doing here tonight, sorry. And then the option 3 was just to completely ignore it. But the findings are the key bit, really, at the bottom of page 10, the top of page 11. And I think if you look at paragraph 10 in particular, you've got bit A to G, and they really do highlight the things that were very, very important for running a community hub. And I think for any executive member who was to look at this, they were the recommendations, they're the key points that we highlighted from our work that would be important to make sure that they had taken seriously. So that's really what we did. You can read the words. I hope you have. Councillor Fenton, anything to add on
that? Not really, other than thank Maura, Scaife and Isabel Kieran, who did a lot of work and provided a lot of support in terms of arranging for us to meet with representatives from a sort of a broad, sort of fairly diverse range of some voluntary, some community, some kind of other other form of entity, all of which had really different origins, but through talking to them, there were some common themes in terms of some of the prerequisites for their success. One of them even mentioned support from their local councillors, which I thought was quite interesting. So that was, you know, it was really, really helpful to hear how people do things outside of York and to pick out some of the sort of key themes which are set out from A to G, which I think pretty succinctly encompass the sort of key findings, really. But I don't know whether Charlie has any thoughts on whether on how whether it's just the findings you would have expected, or whether you thought we'd come up with sort of different observations. It'd be interesting from our perspective to hear your views.
Yeah, I think it's a really positive report, Chair, and helpful in focusing in on the areas that absolutely need attention and need focus in each community, and I think set a positive agenda for working with members, getting our community officers mobilised around wards, as I know Maura wants to do, and getting them focused on community hubs as a key part of ward work and working with you, and gives us, I think, some really useful information and focus around how implementation might happen. Of course, you know, we can't give answers in every ward, can we? And every circumstance will be different, but it at least kind of sets out some of the key areas of focus, I think, and some of the key issues that need to be tackled. And does, I think, helpfully give a sense of how funding should be directed. There are a couple of different funding pots around. As we know, we still have that commissioning pot that we kept and rolled forward because I think it was felt it would be unwise to dissipate it before this committee task group reported. So we've kept it in order to focus it around the outcomes of this review. And of course, members have their own funds and their COVID recovery funds as well. And again, these aren't silver bullets. These are all one-off funds, and the report clearly talks about long-term sustainability. But I think if those funds could be used in ways that helped, to seed corn fund, maybe to help develop business plans and to look around sustainability, then that might be a way of sensibly directing those funds to meet the points that you've made in these reports. So yeah, as I say, all the work is still to do on the ground in each case, isn't it? But I think this report gives a really helpful kind of framework and set of issues that now need to be action needs to be brought to bear on.
Thank you very much, Mr. Croft. Right, in that case, shall we, as we did before, work through the recommendations? I think probably from 10A to G, make sure we're happy with them, first of all. The first one, A, is the ability to support on a range of issues and not just one. As a principle, residents who make use of community hubs, a particular issue, often have multiple complex needs. Any thoughts around the table on that one?
Just think, I mean, it basically, I don't want to say it states the obvious, but it kind of does really, doesn't it? That I think that there's no community where there is one particular focus. And whilst, you know, if I take an example like Bell Farm in my own ward, where residents come together and provide food, they also have support with credit unions and debt advice and things like that. And it was that idea that you have multiple agencies working at the same place.
It's certainly, in my experience, exactly the same, that people come together for one particular purpose, but there are often many other complex needs behind that. It could be health, it could be employment, it could be training, it could be all sorts of issues. And I think hubs are very well positioned to support a range of needs across the community. So I'll be happy with part A. Okay. B, it's a clear desire to help people, but also tackle the source of problems and not just the symptoms. I think that's very similar to A, but I think it's
If I may, Chair, I think, you know, in a lot of cases, the source of these problems is poverty. And we talk about food poverty. We're about to go on to one about food, but in reality, it's just poverty. And A is tackling symptoms. B is highlighting the clear need to advocate for these people and to look at, okay, we might need to give this person a food bank voucher this week, but we can't indefinitely give that person a food voucher. We need to give that person the ability to support themselves, or they need to look at what is an issue around benefits or universal credit or whatever it is, in order to support that person. So that's kind of what that's stating there.
Are we all happy with that? Yeah. C, an opportunity to bring communities together whilst providing safer spaces for residents with sensitive issues. I think that's a very valid point. It's providing a safe space for residents to discuss often very private issues with professionals whom they feel comfortable with. I think that's a vital function of hubs. Will we all be in agreement with that? Okay. D is a volunteer base to help with capacity and provision. I think we all are familiar with hub volunteers across the city and the very valuable work they do in communities. So I think that's a very important point to make in the recommendations. Are we all in agreement? Okay. E, almost all the community hubs spoken to had at least some paid staff. This seemed to be a key element to a lot of provision. Councillor Fenton.
Yeah, again, that's kind of what we heard, and it's not, in some ways, not a surprising finding, because if you want to have a team of volunteers need to be managed, to be led, to be empowered, and sometimes it can be a volunteer leading other volunteers. Sometimes it can be a member of staff of the council whose remit can extend to that. But certainly in my experience, having someone whose job it is and who is appropriately remunerated for doing that it can put the provision on a different kind of footing in terms of offering a bit more certainty and stability, although you then have to raise the money to pay the paid member of staff. So it's there are challenges around making that that remuneration sustainable, but I think as an objective, I think it's the right one to have.
Thank you. Councillor Webb.
Just on that, just an example from my own ward. There's a building called the 68 Centre, so called because it was built in 1968. And I might be being mean here, but I don't think it's been touched since 1968. As such, it is now at the point where it is, it's been left to go to rack and ruin. And there was a point where that building was essentially being offered to a community group to take over that community group and run it as a community centre, as a community hub. And it's the perfect spot for it. It's a site for its council land, but the building itself is in such dire need of repair that community groups aren't going to take it on. And this is something that I think we need to look at as a council, because what would be, you know, not a tiny investment, but a capital investment in any buildings that we have like that, to get them up to a standard that then a community group could adopt. And at that point, then you can let rooms, you can let space, which then pays for that staff, hopefully, in order to really benefit that community. And I do agree with everything Councillor Fenton said around the need for some sort of paid staff member, because often that person will be the person who's actually drawing in other funds as well and bidding for different charity grants and things like that. But you know, what we have as an advantage, what we have as a lever as a council is some land, some space. But unless there's that capital investment in potentially buildings that exist, or, you know, buildings that don't yet exist, but if we could provide that space on council land, then it really just push that conversation a bit further forward. And I know that that's a big ask, and that's why it's not quite made it into these recommendations. But I do think that it's something more long term that we do need to look at, because it will certainly reap benefits in lots of different areas of lots of different communities in York. So yes, I think it's something that it didn't seem appropriate to fit in with this report, but I think it's worth saying it here and now.
There probably are several similar places around the city which could do with a range of improvement to bring them into usable form. But as you say, for the longer term, perhaps. That was E. Going on to F, a clear means of income generation, whether that be through council grant, national lottery funding, or in some cases, found a building lent to a community hub on a long-term lease, gave that organisation the ability to rent out space to generate income. It was clear that without a suitable funding model, these community hubs would fail. I think that's very, it's very to the point. I think that it probably has to be, that there has to be a clear route to generate income for the hub over the longer term. We are also, obviously in our minds, wishing all these measures to be sustainable over the longer term. Any thoughts around the table, please? Councillor Fenton.
I think you can have a robust business plan, but sometimes things happen. COVID happened. I know many organisations that you know, the bedrock of their financial strategy was the ability to let out space. Obviously, the space wasn't there to let out, but the need was still there to service, which I suppose poses more, you know, further questions about even greater diversification. But again, it brings you back to when you have a group of volunteer trustees in many cases, then do they have the time to be able to do that? So I think many people are very good at sort of ferreting out sources of funding, which often is asking Maura, you know, what's up for grabs at the moment? And a small number of people know, but they can't write every funding bid or support every organisation that wants to and needs to, and is deserving of funding. So I think it's important that is brought out here, because, you know, we do have a somewhat fragmented system where it's a case of bidding around, you know, to as many organisations and foundations as possible, but you know, that we have to try and make that work. You know, and maybe there's a it's something that community involvement officers can help with in terms of signposting to sharing information that they have as a group with community and voluntary organisations through councillors and others. So I think there's there's more we can do to really maximise the benefit that we get from the money that is available, but appreciate it's not always easy to track down where it is, who's bidding, what the criteria are, but it's become a necessity.
Thank you. Any other thoughts on the table? Councillor Heaton.
Thanks. Yeah, no, just on the sustainability, that's got to be a core thing. I mean, I'm sure we've all been part of organisations that have been sort of like driven on by one individual or small group of individuals. But as we know in life, people move on, and you know, you can't be relying on one person, 2, 3 people to have an organisation like a whole be sustainable. You need to have some sort of proper model in there, and it needs some sort of structure in place to achieve that.
Thank you, good point. Any other thoughts? Okay. Last one then is G, a clear method of community consultation to generate community buy-in and identify community need. Councillor Webb.
Yeah, on this one, I think this was something we highlighted quite early on, actually, that what might be the top priority and relevant in Wheldrake might not be the top priority and relevant in Town Hall. But both will need something. So, for example, it could be loneliness in one part of the city. It could be abject poverty in another part of the city, and access to food and benefits advice, for example. And if you don't get the right things in the right place, obviously you're not going to get the community using it. But also, if you haven't involved the community in the first place in the setting up of whatever it is that's needed, again, that can cause frictions. It can cause this view of, oh, well, it's someone doing something to the community rather than the community sort of working all the time to support themselves. And I think that that's something I'm sure we've all experienced as councillors ourselves, that getting that community buy-in is the really is another active ingredient. And I think it is got to be open and honest. And I think that's the point of a clear method of community consultation. It's like, we have to have a clear, open dialogue with people in the community to see what is needed, but also how they're involved in this and how that works. So yeah, so I think consultation and work with community is really key.
Thank you. Anyone else have any comments to Councillor Heaton?
Thanks. Yeah, and just to follow on from that, I think there's an element of sort of keeping our nerve with some of these things, because it's very easy and very tempting with a lot of these to go, you know, there's an issue here, we need to solve it now. But sometimes that extra bit of consultation will give a bit more time, but it'll mean a better outcome in the end. I think that's something we've got to make sure we focus on as part of it.
Lovely, thank you. Right, that's so we've agreed A to G, but I think in terms of the wording, it needs a bit more sharpening up. I'm going to ask Mr. Croft if he could help with this. Perhaps delegating the planning model to chair and vice chair in terms of wording to finally agree it before it goes to executive. Basically measurable recommendations, and also obviously smart, so that they're achievable. And I think I'd change the first one to something like community hubs should support on a range of issues, not just one. It could be quite brief and sharp like that. That makes sense to everyone?
Like the first report, this will need a covering report from an officer, and I imagine Charlie is the right person to do this. So as part of that, I'd hope that Charlie would maybe at least pass it by us, Chair, to sort of see if it did what it said on the tin. But yeah, I think I'm happy to work with you and Charlie on that outside of this meeting.
Is the covering report enough, James, in this instance?
The covering report's being written at the moment. The covering report's being written at the moment because it needs to be on the agenda by next week, but it'll be done. But I suppose we could email you a copy. Yeah.
So it could be done via that covering report. Does that make sense? Okay.
Yes, because the covering report is a kind of response to the, isn't it? So it's not really a matter of, it wouldn't be a matter of changing the recommendations here, would it? It would just be a matter of kind of, making a response in terms of saying how they will, how they can be implemented, really, isn't it? Yeah.
Okay. Great. Right. Thank you all very much for that. Move on to the last item on the agenda, which I think is number 6, not the last item, the last report, item 6. I can find which page it is. Thank you. No, it still helps. 91. Right, this is a report requested by Executive at their meeting in September 2021, where they asked for a report from us on the effectiveness, impact and funding of the free school meal voucher scheme alongside other grassroots community-based provision and other schemes to address food poverty impacts. And this is particularly around the issues of those youngsters receiving free school meals were not going to do so during the holiday periods, and therefore there was a pressing need. Now, I'm grateful to Pauline Stutchfield beside me, who provides a scoping report for us, which we considered on the 28th of February. And we looked at, first of all, the entitlement to free school meals. Pre-pandemic, there was no additional funding at all to support families during school holidays. But during the pandemic, there was a marked increase in the number of children eligible for benefits related to free school meals. School census data showed that between January 2020 and 2022, there was an increase across primary, secondary and special schools, rising from 2,721 in January 2020 to 3,624 in January 22, an increase of 903 or 33.2%. During the period of national lockdown, the government had used the National Voucher Scheme to fund food vouchers for children eligible for benefits related to free school meals. This provided food for those children unable to attend school and extended to cover the school holidays in 2020. Schools received funding directly from the DfE to provide food during the period of the first national lockdown and to provide food assistance during lockdown between January 2021 and March 2021. But this direct funding to schools did not cover the school holidays, and the government provided funding through the various grant schemes for food and fuel. Together with other local authorities, the council chose to extend support for free school meal vouchers during the school holidays from October 2020 onwards. And I then listed the amount of money that the council spent. It's quite a large sum. I think for a whole year, it's something in the region of £750,000 to provide funding for £15 per child per week for 13 weeks of school holidays over the year. From September 2021, there was and is no requirement for schools to provide free school meals during school holidays. And I think the view of the DFE is that this sort of thing should best be provided through central government's benefit schemes. Various studies are then listed from paragraph 13 onwards, looking at the key findings. I'll just pick a few out. The evidence on food insecurity indicates that many families with children have a year-round challenge with consistent nutrition, whether or not they're on welfare benefits or on receipt of free school meals. Local councils rarely fund provision. It mentions their Derbyshire example. In terms of the task group of Councillor Fenton, Fitzpatrick and myself, we're awaiting some information from York Schools to obtain their views. Councillor Fitzpatrick, as you're all aware, is unwell today. She was hoping to get some information to me before the meeting started, but certainly when I left home and checked later, it still hasn't arrived. So I hope she's getting some rest. We also obtained some information from York Food Bank, and I'm going to read out one particular quote they sent to us. They said, in previous years, August in particular would be a peak month for the food bank, driven by the issuing of extra vouchers and summer holidays. We offer additional free vouchers, which we invite schools to issue to families at their discretion to help in summer. And they also do that in each of the COVID-19 lockdowns too. By contrast, August 2020 and again in 2021 saw a decline in overall food bank voucher fulfillments, which they interpreted at the time to be a direct result of the school meal voucher provisions, which were in place. Either fewer families redeemed vouchers or schools issued fewer of them, or a combination of the two, in the summer holidays of 2020 and 2021. The task group then suggests that this strongly suggests the popularity of the school voucher scheme in moving food support from the food bank to the voucher scheme for that period, underlining its impact for the families that benefited. At a local level, many communities will have their own informal and formal organisations who provide or distribute food to residents in times of need. At page 97, we've given examples of food school-based provision. 98 are examples of community-based provision, and listing the main hubs and so on that provide Red Tower, Foxwood Community Centre, that provide food during school holidays. Paragraph 23 notes that a new post is to be created with the within CYC, the Food Poverty Officer. It's assumed that the post holder will provide a coordination function across the current range of statutory and formal support available to maximise its effectiveness, basically to find means by which to make that well known in the community. In recent years, including my own, some wards have chosen to invest ward funding in school holiday activities run by York City Football Club Foundation and York City Knights Foundation. The provision of a snack pack has been part of some of these sessions. Other holiday hunger activities run by both clubs have merged within the HAF programme to some extent. Page 100, I list the other take-up of income-related support over the period of the pandemic. The York Financial Assistance Scheme, the Household Support Fund, and so on. The figures are given there for under paragraph 29, the total support over the city. The ending of the COVID welfare support schemes by the government has been withdrawn gradually, but by the end of March 22, there's a significant reduction. page 101, it shows how that began to be withdrawn. Paragraph 32 makes the point that the loss of financial support for the financially vulnerable has exacerbated existing issues around debt, food and fuel poverty. A number of residents on universal credit in and out of work remains around twice as high as prior to the pandemic, with January 2022 figures standing at 11,349. Locally, the Council's 2022-23 budget included £100,000 for measures to tackle holiday hunger, of which £57,000 has been spent to support families in the receipt of free school meals at Easter. And the budget also includes £200,000 to support COVID recovery efforts in local communities. From paragraph 35 onwards, I've listed what I call the wider picture. Just to take you back to September 21, there were pressures we have now that were not foreseen then. There was no thought of serious inflation, of fuel costs going through the roof, of energy prices becoming so high, and of course there was no thought of the war in Ukraine, which has affected us in so many ways. Paragraph 37 gives you a bit of a rundown on how these things are related. We know about the costs of gas, for example, and so on, the cost of crude oil, etc., affecting transport and so forth. But for example, the price of gas affects industry adversely. Therefore, buying raw materials such as steel and glass are very much affected. But the war in Ukraine, because both Russia and Ukraine are leading world grain suppliers, that has a huge effect on the cost of food, particularly in terms of chicken and other livestock meats. This sort of thing, but price shocks have fed through to inflation, of course, which have, for most of our recent experience, has been very low, but is now at 7% in March 2022. And the Bank of England seems quite sure that that inflation rate will rise over the rest of this year. I then listed some of the material from the Resolution Foundation, which is an independent think tank focused on improving living standards for those on low to middle income. And they talk through paragraphs 40 to 45 on some of the effects that have been experienced by households and by some of the issues we've mentioned earlier on. And then something from Jack Monroe, who was a food writer and commentator speaking to the Select Committee on Work and Pensions, the House of Commons, just stressing how there are stark choices facing some many households. She said that, and that's not people decide not to go to the theatre or not to have legs of lamb or bottles of champagne. That's just people deciding we won't eat on Tuesday or Thursday this week, or we'll turn the heating off, or we'll skip meals. She believes that people on low incomes are cutting down on food to cope with the soaring costs of rent and energy. I then talked a bit about the Social Trust and food banks. 53 is the Centre for Social Justice, talks about free school meals and holiday hunger. And the end of that kind of section is the DFE saying it is not for schools to regularly provide food for pupils during the school holidays. We believe that the best way to support families outside of term time is through universal credit. Then there's some information on the local picture for deprivation in York. The wards being most deprived of Westfield, Clifton and Heworth. that was for children, the most affecting children, but it goes on similar. There are several different measures which still identify the same wards. I then did a short section on health in York, before leading on to the council's motion of the residents' right to food. Full council on 21st October last year. And within the context of a pandemic in which access to food has been identified as a challenge for many York residents, families and communities, full council approved a motion supporting York residents' right to food. This included actions around setting up a food network, understanding the level of informal food bank use in the city, and using the community hub strategy to establish further opportunity to provide further sources of nutritional food provision activity where it is needed. Again, I've mentioned the community involvement officer food within the communities team, working alongside the HAF officer. That has brought in that additional provision of support. And there'll be two officers, one working on the HAF project, one on food within the communities team. I've then listed the HAF program itself, which is the government's preferred model of how to ameliorate at least the problem of holiday hunger for so many young children, particularly those in the receipt of free school meals. We had a report on the HAF program to this committee, I think in January. I won't go through all of that with you, but there were certainly concerns that it hadn't reached as many children as we'd like. But we also recognized, I think, that it was still fairly early on in its infancy. And there's much work to be done to improve the marketing of the project and make people aware of what it was available, as well as extending what was available and make sure that reached a wider group of young people's interests. And making sure it was close enough to their homes so that there was no difficulty of taking part. I think that's enough from me for a while. Councillor Fenton, would you like to pick up there and move on with the conclusions and recommendations?
Can do. I don't know if obviously the recommendations are informed by all of the work that Councillor Daubeny put in far more than I did. And I know he spent his Easter bank holiday weekend writing it. Thank you to him and to Councillor Fitzpatrick for the many Teams and Zoom meetings. We tended to alternate, didn't we, between the two platforms? Yeah, many long discussions, but it was really, really good work. I don't know if, before we get into the meat of the recommendations, if there's anything you want to say, Pauline, in terms of, because obviously you worked with us on this. Any context you want to provide before we get into the meat of the recommendations?
Thank you. And if Maxine was here, because she's the other key officer supporting you, she'd be saying a couple of things. She would say, firstly, that she expects free school meal numbers to go up, and especially this autumn with the fuel cap increasing and more families going into poverty. The other thing she just wanted to mention about the figures as well, going up by 33%, she believes that there's two causal factors. One is COVID and the financial impact on families, but also families realising what they could claim. They're getting a lot more advice. And obviously the implication of registering for free school meals was that they could get the vouchers and enter the HAF scheme as well. So just that context, I think, is helpful. We're certainly taking the view that you set out in the paper that this needs to be a wraparound solution, ranging from statutory and government initiative and support for families through the welfare benefit system, through council support, to support financial inclusion strategies across the piece. And I agree with Councillor Webb that this is one part of the wider poverty picture. And the hub strategy is key to that as well, delivering locally. So that's my third sort of view, is that it needs to be all those levels are focused on supporting families to come out of poverty. Lot of the same conclusions that you drew out the hub strategy, to tackle need at to understand need at a local level, but also to put in some solutions at a local level to meet that need. And those, we've recently done an assessment with partners of the current impacts around what's affecting family income, and all of the things that you mentioned in the hub strategy are relevant around cost of living, food and fuel, the importance of community capacity and support, local advice. Digital inclusion came up as well. To access cheaper, you need to be able to access digital and have the skills to access that. This all helps with isolation, and the fundamental issue is people benefit from those support mechanisms, understanding the cause of the poverty in the first place. So yes, vouchers are helpful, but they may only be a sticking plaster to the underlying issue that might be affecting the family. So it is important to have that complete wraparound care. And the recommendations that you've come up with are the ones that we recognise that complete that circle in terms of trying to understand the need and address the causes as part of a local solution. I guess if I was commenting on the recommendations, it's been clearer about what recommendation 1 says and what it's not saying around the funding, and I will need to make do some financial implications around that. So if it is to fund the vouchers, obviously you mentioned, Chair, the total cost of a full year's funding of vouchers in the same way as we've been providing in the past. An option around how we've been delivering this in York, around providing vouchers 1 week and half delivery another, because half isn't a year-round solution. And what we do with any remaining funding that exists. I think what you've done in the report is quote the funding that you feel is available, and I think that's right. I think you've got an accurate set of figures there. Anything else would need to come from somewhere else, and the executive would need to consider how they would want to fund that. It's not there at the moment. There's a budget process obviously for next year, and they need to consider that. I think the other recommendation 3, just wanted to clarify that the 200,000 isn't a top slice. It is something that's already been distributed towards and would sit alongside any local decisions and prioritisation of issues that ward members believe are important. And wondered really whether it would be helpful to have a menu across the wards around what options might be available in relation to food, particularly in those wards where you've seen the data support further activity within a ward according to need. I thought it might be also useful for you to know that we're adding to the data sets for the ward profiles, and that will include free school meals. I haven't got a date for that at the moment, but I thought that might be helpful as well for ward members to see that kind of data. It'd be helpful to have any feedback if there's any other data sets that you might feel would be useful as well. Everything else absolutely fits with the discussions that we've had. Thank you.
Shall I carry on? That we can stop at each recommendation and have a discussion, if that's okay. So recommendation 1, I think what we were saying here is, as the chair alluded to earlier, the DFE's line is there's universal credit, and that, you know, that's it. I think what we're saying here is we disagree. And we believe there needs to be, as a city, we need to do something in addition to what the government requires us to do. And then the following recommendations kind of set out what we think that could be. So I think what we're not saying here is that the £15 a week per pupil voucher scheme should continue in its current form, because we, as Pauline said, we have tried to look at what money has been assigned in this financial year and that full council's approved. But we have kind of made mention where we think there may be additional demands, but that's basically the parameters within which we've sought to make recommendations. If that makes sense. Any thoughts or observations about recommendation 1?
I'll just jump in. Yeah, I think it's fair to say that we're pussyfooting around the fact that we've got a ruthless government that has cut universal credit, sets up a system for people to fail, and is enforcing poverty on huge swathes of the population, and it's not good enough. I think it's all very well and good me ranting about it here, but we do have as a council a fixed budget, and I recognise that, and I think there's only so much that we as a local authority can do. But I think the following recommendations, I think it's key for us as a city and for the executive when they receive this to really think about, well, we need to make sure we're maximising and everything we can possibly do in order to support our most vulnerable. And I think that, the task group therefore believes that it would not be appropriate for there to be no holiday food provision put in place is absolutely key as a foundation for that. But yeah, it's about what actually happens, because that's fine, isn't it? We can say that, but it's then what comes from that. So yeah.
Microphone.
Thank you. I think at that point we had to recognise just how much the full year free school meal provision would be, to underline the fact it's not affordable. What government can afford is I mean, they've clearly borrowed heavily, very heavily, during the course of the pandemic, and that was one of the recipients of their borrowing. But it's not something we could carry on doing.
Apologies, Chair. The numbers in here, but it eludes me right now. How much is it per year then we're talking about?
It's £50,000 per week and 13
Yeah,
weeks.
that's what I thought it was, but I just wanted to confirm.
It's edging towards 60,000 though
as numbers grow, or as
numbers grow,
costs increase.
No, if we're just basing it on a £15 per child per week.
And of course, we're £15 last year is not £15 this year, is it? So yeah, it's not ideal.
Good point.
Carry on, Chair.
Mm-hmm.
Yeah. So recommendation 2, we've previously discussed the holiday activities food programme and our views on that we have shared, and I think it's fair to say we have concerns that it represents the most effective use of money by government. It could be designed and delivered in a way that was far more inclusive. However, it is what it is. So recommendation 2, recognising its limitations, calls on CUIC to continue to promote it and work with providers to make activities as accessible as possible. I suppose the thing I would kind of add to that, since we wrote this, having reflected on it, is maybe there's some kind of lobbying we could do as well, in terms of, for what it's worth, lobbying government, saying, you know, couldn't you just give the money to the schools so they could open the kitchens during the school holidays? Which I'm sure is far more complicated than I'm making out. But, you know, whether there are opportunities for, whether DfE does ask for feedback in terms of how is the HAF scheme going, how could that funding be perhaps better utilised to deliver the outcomes which is designed to achieve, is probably the one thing I would add for the sake of adding it, in case it makes any difference. Any comments on that?
I'm sorry, Chair, and I'm sorry I keep jumping.
On
Paragraph 72, the council motion around the residents' right to food. It was Labour that put forward that motion, and within that motion there is exactly what you've just said, Councillor Fenton. There is who to lobby, how to lobby, and what to lobby them on. And also there is within it, and I was going to ask a question about this, about halfway down that paragraph, it says, this included recommendations around setting up a food network, understanding the level of informal food bank use in the city, and using the community hub strategy to establish further opportunities. Part of that's not explicit within this was around looking at what exists within a community that could be used. So, for example, there are in a lot of places school kitchens and canteens that are not being used in the holidays. And you're right, Councillor Fenton, I'm sure it's not as easy as just saying, yes, we should use these things. But, you know, Councillor Daubney spoke earlier on about the issues around the cost of heating and gas and things like that. You know, we are genuinely having to think about what goes into food packages to make sure it's not something that needs cooking, for example, because people can't afford to pay the gas meter. So if there are options, or we could explore what provision there is within the city to support each other throughout the holidays, that might go a little bit of the way to making the maximising what we have available. And it's certainly not a simple thing, but it was within that motion, and I'd certainly endorse what you just said there regarding the addition to recommendation 2.
Thank you. And I think in terms of the so the mapping point, we can maybe pick that up in recommendation 3, which we'll now move on to. So when I wrote the report, I hadn't properly understood, this is my confession, I hadn't properly understood the £200,000 referenced here, which is also appears on page 12, is a COVID recovery fund that has been delivered through ward budgets. So in that context, the recommendation 3, as we've written it, doesn't align with the actual mechanism used for distributing that funding. So what I would like, if I can read out a revised form of words for us to discuss to recognise that, and then we can have a sort of discussion about this particular recommendation. So how I think I would propose to reword it is saying, in determining how the £200,000 for COVID recovery efforts should be spent, ward teams should prioritise supporting settings and providers that, with appropriate support, could deliver a school holiday food offer targeted at those most in need and for whom other support may not be accessible. So it sort of maintains the thrust of that recommendation, but it just recognises the the way in which that funding is being distributed. So picking up Councillor Webb's point around sort of mapping formal or informal provision, clearly if we're saying to ward teams, you should prioritise, this should be your priority. Ward teams, some will have a very, very good idea of what exists and what needs support. In other areas, it might be less obvious. So I think that's something that we could incorporate here. And picking up Pauline's point around sort of, working with wards in terms of, not solely in terms of a better set of data, but a bit more practical information in terms of what options and solutions might be available, some more readily than others. So that's how I would propose to couch recommendation 3, and apologies again for when I wrote it, I hadn't made the connection between what appears on page 12 and what appears here.
Thank you. I think that provides clarity. Any thoughts around the table? Councillor Webb.
With that 200,000, is that something that's come from government and then it's fed through towards, or is that something that the council executive budgeted for and is ongoing year on year? Because I'm just trying to say that whether, next year it won't exist, for example.
Yeah, the 200,000 is from COVID government grant, so one-off.
So it won't exist after this year anyway.
No.
Yeah, because I suppose my only thought around that is, I think then, I suppose that what your revised recommendation is probably just needs to mention that as well, just that this is a non-recurrent, but apart from that, I think that's the best you can do really with that, just to advise, because obviously we can't re-budget halfway through the year, could we? But you could say provide advice, and I think there's on the final recommendation about advice, if that potentially linked in and said went toward councillors as well, that might help focus their minds.
Okay, thanks for that. Okay. Recommendation 4, so this goes back to what the £100,000 which is in this year's budget. I'm sure Charlie or Pauline will tell us whether that's non-recurrent government funding or CYC funding, but let's not worry about that just. So we know there's £43,000 of the 100,000 remaining, earmarked for school holiday food provision. Recommendation here is it should be made available for local area coordinators, schools and community organisations to use to issue supermarket vouchers to families who are in need and for whom other support may be inaccessible, going back to the HAF discussion. And then if demand proves to be high, executives should look at ways in which this fund could be supplemented from other sources. I don't know whether, I know in the meetings we had, Pauline, you talked about, and we picked this up from discussions we had around the existing ability for some individuals and organisations to issue supermarket vouchers. And I think I'm clear that's different from a referral to the food bank, which again, some individuals and organisations are able to do. So does this hang together in terms of how we've sought to explain it?
So to answer your first question, this is council funding, one-off funding, pending the outcome of the scrutiny review, so £100,000. I haven't got the final figures. We think that we spent £57,000 the first week at Easter on the school meal vouchers, leaving 43,000. Now, what we've done in the, since December for the first time is issue fuel vouchers through our advice partners, through Advice York, and also our staff on the ground in communities. So that's community involvement officers and local area coordinators and people like Citizens Advice, Peace Home. Range of organisations can access a system called Charis to access fuel vouchers where they see the need locally. And the feedback we've had from the local area coordination team is that that's been a godsend for some people. And it's an immediate reaction to need as they see it on the ground. Now, Charis can issue food vouchers as well, and that's what we're proposing to do with £50,000 top slice from the next household support grant. Now, that's not an agreed recommendation yet. That's going to Councillor Ayres' decision session next week, as well as the distribution of the household support grant, as we've done previously. What's different about that grant is that 33% of that has to be spent on pensioners, whereas previous to that, it was all spent on, well, half had to be spent on families and half on anyone else who needed to claim. So what I'm saying is we've already, if Councillor approves that, we've already got a fund of 50,000. If this recommendation is one you want to proceed with, then that 43,000 that's left from the 100 would be added to that. So you'd have near enough 100,000 for food vouchers that could be distributed locally in the same way as the fuel voucher scheme, which has already, we're seeing has been an effective way to meeting local need on the ground as an alternative to the free school meal vouchers that we've issued in the past.
Processing that in terms of different bits of money coming from where. So the household support fund, which I initially thought that stopped, but then the government said there'd be another round of it. Okay, I understand that bit. And so we will top slice an element of this to bolster our food and fuel voucher capability. And the remaining household support fund we will distribute in line with whatever the government criteria are for distributing that.
Yeah.
Okay. I think I understand.
With the York Financial Assistance Scheme, do we use all of that every year? And is there an ability to direct some of that funding into this pot? I mean, what specifically is it used for now that wouldn't cover food and fuel, for example?
It is used for issuing for supermarket vouchers for some families. When the scheme first started, it was transferred from the government as emergency funding for families, and it was a cash scheme. It is now a voucher scheme because of some abuse that we have with the system, and that's something that's learning across the UK. So we now issue food vouchers or fuel vouchers as we can now through Charis. But part of it is also for people moving into the area and needing furniture, for example, and white goods. So we work, and again, it's not about money. People are referred to the community furniture store for whatever their needs are from that respect. So, and it's fully spent. It's been fully spent for the last few years. There was extra money put in. Obviously, the extra £1 million went into COVID support. So we spent 2/3, 3/4 of that. But it did support the traditional Wi-Fi scheme, which overspent in the year. This year, the executive had put in an extra 50,000. So the normal budget is around 209,000 a year, and we'll have 259,000 this year for Wi-Fi. But we're anticipating spending that. Some of the other financial schemes that we support residents with, such as discretionary housing payments, we've got a third less to support residents, and obviously housing costs are going up as much as fuel costs, as much as food costs. So it just gives you the picture that actually some areas are not funded as well as they have been previously.
Can I just come back on that? You've highlighted something there, that the difference between cash and vouchers. And I think it is, I recognise what you're saying, that there is, you know, potential for abuse by giving someone just the cash rather than supermarket vouchers. And I'm glad of the fact that we're doing either. But I do think, you know, we're talking about people who have to budget to within an inch of their lives. They know how to handle money themselves. And I do think it's a little bit sad sometimes when we feel giving vouchers is the right way to go, rather than literally giving these people who often through no fault of their own have found themselves in poverty, almost saying we don't trust them to spend money on things that will help them survive, you know. And I think it's an argument for another day, I'm sure, but it does seem like a real shame that, and I know I've mentioned at the last meeting, I've been speaking to the manager of food banks over in Leeds about the fact that they're doing a pilot scheme where they essentially give just cash out, and that's come from their version of a sort of a financial assistance scheme. And it'll be really interesting to see what they find from that, because, you know, we really are talking about a much wider range of people now having to access this cash than ever before. And I just think it's a shame that people feel it's appropriate to give people vouchers rather than just giving the families the money to get on with and deal with how they want.
Respond to that, Chair?
I know, yes.
We do have another scheme, but it's one-off money, unfortunately, which our local area coordination team manage, and that can be in any form. And I can't remember the figures. I think it was about 60,000 in total. And that again is about responding to local need and local circumstances, and that certainly can be good. Hope that's helpful, but happy to learn from others.
Okay. So I think we're done with the recommendation 4. Yep. Recommendation 5 we've kind of already touched on in terms of Pauline's explained if we approve this recommendation, how that could potentially come to fruition in terms of a decision that the executive member will be asked to make in terms of its use. In terms of we're talking here about specifically targeting that additional support at families whose children are eligible for free school meals. That would be I'm trying to think, are we unnecessarily constraining ourselves? Probably not. Just mindful of what you were saying earlier, Pauline, about there will be a, we already know there are families that currently do not fall within that category, but may do in future. But I'm guessing we have to use some metric in order to target how, how best to target that, that support. So, I mean, does that, as recommendation 5 is currently worded, does it give sufficient clarity as to what our expectations are?
Yes, I can respond to that with what we're doing with the household support fund, and we've got a discretionary element of the scheme that if further people fall into poverty after we've given out the grant, there's going to be a pot of money still available for people to apply for should they fall into difficulty. So that gives you some flexibility, but I can respond to that recommendation.
Yeah, no, I was conscious, obviously we haven't seen the rules of this latest scheme, but yeah, useful to pull that out so we can see,
Yeah.
you know, for maybe families that might not fall into this category, how else they could potentially benefit. Any comments on that recommendation? No. Okay. Recommendation 6. CYC to produce an advice and information pack designed to signpost families to sources of information and support, accessible to all. I think it kind of picks up one of the points which maybe we need to make it more explicit in here that Councillor Webb made earlier around mapping what exists. Because yes, we could give people some leaflets about debt advice and things that perhaps are not it's sort of immediately practical in terms of if you need help now, where do you go? Who do you talk to? What do you do? And I also conscious I haven't sort of tried to identify a cost for this or B, a budget from where it comes from, but I'm sure you'll figure that out. And similarly, I didn't really have time to investigate, well, what has been done in the past, what could be taken off the shelf and refreshed. Obviously, we have done this in quite a short period of time. But again, I'd be grateful for any questions from colleagues as to, you know, is that enough? Should there be more that we think would be helpful, and any comments from Pauline about sort of doability.
I was going to say, I think it should be accessible on the internet, but in printed form as well, available through schools, and just to make as wide a circulation as we can to make sure people have access to the information when it's there, particularly targeted those in need. By all means, yes, a web.
Always desperate not to have to remake a worksheet once you've already done it. During the pandemic, I know that when we were sending out food boxes, there was sort of packs of information that was within there. There were positives and negatives to some of that content. There was bits and pieces missing, I think, at times, but I certainly think it'd be a starting place on that idea.
So yes, there was information all very quickly pulled together in one place, and we would always signpost people to Live Well York as a good source of information, and that's where we would put any of this documentation. And we did issue some similar information out to schools in light of the emerging conversations around the scrutiny review, as they were ordering the vouchers for Easter holidays. There is that element of prioritisation though, which has been recognised. I run a regional recovery debt and poverty group, and actually when someone's in crisis, what should they look at first? What's the key thing that they need to be thinking about in terms of where should they be spending their money as a priority for their family to keep them safe and secure? And that's what we're looking at now, is looking at whether there's a leaflet or something that we can produce that helps them do that. Budgeting always sounds a bit obnoxious, doesn't it? It's about, you know, helping somebody in crisis think about where they should be spending the money, how they could spend it, where they can get the funding from for those critical issues of food and fuel and rent or mortgage, are the things that, you know, can affect people's lives. So that's what we're looking at the minute, but you've got my guarantee that we will ensure that information is available at the next school holiday for all the parents and children to take home that information set about where they can get help. And you mentioned ward councillors, Council Web, so we'll make sure that that information goes out to ward councillors as well. And I think that needs to happen at the beginning of every school holiday.
Could we kind of break this down, Pauline, into sections so that people can kind of pick and choose what they think is. Otherwise, as Councillor Webb's reminded us, there's so much available that people might feel overwhelmed. I mean, nobody wants to have something that's for an executive report I saw upstairs earlier. I mean, even today's papers are fairly large, aren't they? But, you know, these took some reading through. And I think someone who's not used to a lot of information might be overwhelmed. So if it could come in section A, food, section B, housing, something like that, it might be useful for people to cherry pick what they felt was useful to them. Perhaps be guided in that. But if they want it all, they can have it all. If you don't want something on food and fuel and that kind of critical issues, if you like, that might be helpful to them.
And that concludes the recommendations of the Holiday Food Task Group.
Thank you very much, Stephen. Sorry, Councillor Fenton. I think at that point, of course, we then pass these across to Pauline for the covering report that needs to be written before it goes to executive, which covers things like costings of the various recommendations that we have made. Thank you very much for that and your support in the scoping report and at other times as we worked our way through this quite large task. Thank you. And thank you, Councillor Fenton and Councillor Fitzpatrick in your absence for the work which we all did together. We've now got the work plan to look at. Do you want to leave us, Pauline? Maybe. Let's keep you unnecessarily. Thank you both very much for attending this evening. Thank you. Right, our next meeting is the forum on the 23rd of June. Currently we have one item there, the annual outline of aims and objectives for the forthcoming municipal year by the leader and relevant portfolio holders, including any significant issues likely to be in the forward plan. I wonder, Jane, whether you can advise us a bit on what form this takes.
It's a forum, so it's in private, but it will be, well, it could be, I think it's on Zoom actually. I need to double check.
Right.
But I think it's on Zoom.
That would make sense. So we'd have executive members to talk to as we chose. Right. That sounds very good. And our meeting or committee in July is quite a busy one, to say the least. We have the York Learning Annual Update Report, including digital inclusion and post-COVID recovery. The cultural offer, Reach Update and York Explore Annual Report. Skills and Employment Board Update, item 3. And item 4, I think one we've been waiting for quite a while, the staff absence sickness rates within the People's Directorate. There are two items for discussion or consideration. One is a rearranged joint scrutiny with HASC on the autism strategy, which is moved to 27th of September to be confirmed. And we've also been asked to consider a public health school survey, findings of what the public health team are doing to respond. Now, I gather they wanted to come to our July committee. I'm conscious that could be a very busy evening. How do people feel about 5 items on the agenda? Does that sound too many, or Councillor Fenton?
Can you just repeat? Public health
School survey, the findings and what the public health team are doing to respond
to the survey.
I assume so, yes.
That could be quite, sounds quite a interesting / meaty
Yes.
topic. So, I mean, I suppose we could discuss it in a forum meeting, but then, yeah, so maybe if we discuss it in a forum meeting, if we think it's an issue, well, we don't know what it is yet, so it's hard to decide whether it's likely to be an issue of, you know, significant public interest, which really should be discussed in a public forum, which should be our default in terms of, you know, having any you know, significant discussions of interest. So we can maybe discuss it at the forum meeting, and then if we thought, you know, it warrants a wider airing, we could put in a bid for a specific meeting. I don't know.
The next meeting date is October, which is a committee.
I wonder if the public health were ready, could we discuss it as part of 26th of June? My thought being that I'm sure that our executive members will come bursting with ideas of things that they would like us to discuss and consider over time. And I'm sure there will be things that will be really relevant. So, for example, the council's response to Ofsted, who were in children's services a month back or so. I think actually putting that on that forum meeting as an item would be important. But I think if public health were ready to come to that forum in June, that would be, as Councillor Fenton said, an opportunity to then say, well, look, is there any further stuff we need to do, or would that?
They've said July, but they won't know what our commitments already are. So I think, do you want to try that, Jane? And I'll ask them whether they can make the 23rd of June. And there are, of course, as we all know, quite a few annual reports and so on, which come to us, and other things which we need to look at on a regular basis. So there'll be quite a few things on that forward plan, I think, very soon, which will be commanding our attention. Right, that's probably it, I think, for now. Councillor Fenton.
Just on the to the June forum, what we said, any significant issues likely to be in the forward plan. So we can all look at the forward plan, but I think I'm as guilty as everyone else as not looking at it as regularly as I should. But it may be, if you could have a look at it and in advance of the meeting, pull out issues we can see on the forward plan that we think might lend themselves to some sort of pre-decision scrutiny or post-decision scrutiny, whatever. Yeah, rather than just remember at the meeting that, oh yeah, we're going to have a look at the forward plan.
Yeah. Yeah, we'll do. Shall we do that together, Councillor Webb? Would you like to take part in that? Perhaps with Jane's input too, and we can look at things which we think the committee would be interested in and would like to see and discuss.
Yeah, I think
either before decisions or after. I think I like the idea of pre-decision scrutiny where it's possible. I think it's adds a value and different perspective too for the executive member to have our thoughts in advance rather than us commenting on what he or she has decided.
Yeah, I think if we can come up with a time prior to June, but not too far in advance, because obviously the forward plan changes, doesn't it? But yeah, a couple of weeks beforehand.
Yeah, so we said early June.
Yeah, perfect.
I need that with you, James. Thank you. I don't have any items of urgent business. Does anyone else have anything they want to raise? No? Right, in that case, I shall declare the meeting closed at 25 minutes past 7. Thank you all very much for your work this evening, and obviously for coming along and giving us your wisdom.